All attendees are in listen-only mode.
Good afternoon, everyone, and thank you for joining the Worksite Lactation Support Recognition Initiative Virtual Cross-State Forum. I'm Alma Carver. I am the Project Director for the Texas Mother-Friendly Technical Assistance and Support Program here at the University of Texas Health Science Center School of Public Health. Just to give you a sense of what we're going to be covering today, give us 1 second. Just to give you a sense of what we'll be covering today, you'll see an outline on your screen. We'll do brief introductions, then we'll have an overview of the Texas Mother-Friendly Worksite Program, and then an overview of the state initiative's research, findings from that research, addressing programmatic challenges, and then discussion of national collaboration. So the team that helped to plan this event, myself, Kelsey Heron, Riley Stoltenberg. You can't hear me? Sorry, we're just having some technical difficulties with the sound. Hopefully everyone can hear me now. So to introduce the presenters, we have Amanda Reet here, who is a PhD student in epidemiology at the University of Texas Health Science Center School of Public Health. And we have Julie Stagg, who serves as the Texas Department of State Health Services State Breastfeeding Coordinator. And at this point, before we jump into the actual content here, I want to just let you all know that there is a question box that should be appearing on the right-hand side of your screen. If you have any questions throughout the session, please go ahead and type those into that question chat box. Also, there should be a separate box that says chat. If you wouldn't mind going ahead and typing in your name, your role, and the state you are calling in from, that would be very helpful. In addition, there is a raise hand icon that you can select if you would like to ask a question throughout the session. And at this point, I'm passing the ball off to Julie, who is going to talk to you about the Texas Mother-Friendly Worksite Program.
Hello, everybody. Thanks for joining today. I'm Julie Stagg. The long title that I encouraged Alma to just skip over is I'm the Women's Maternal, Perinatal, and Infant Health Team Lead and Nurse Consultant in Maternal Child Health at Texas Department of State Health Services, and I'm also the State Breastfeeding Coordinator, a role a hat that I always have on in integrating breastfeeding and all the work that I do in maternal and child health, as well as the breastfeeding specific efforts. I also coordinate. One of the programs I coordinate in breastfeeding is the Mother-Friendly Worksite Program. The Mother-Friendly Worksite Program is, to the best of my knowledge, the oldest worksite lactation support recognition program in the country. In 1995, Texas adopted legislation to create the Mother-Friendly Worksite business designation. It also, in the same Health and Safety Code 165 breastfeeding, also affirmed a woman's right to breastfeed in any location where she's authorized to be. And the Texas legislature recognized the importance of breastfeeding to not only the health of mothers and babies, but also to society, and encouraged employers to implement policies to support the women in combining working and breastfeeding. So and it laid forth some basic criteria for mother-friendly designation. The backbone of the program that was developed based on this legislation is really the policy, an employer's policy for supporting, creating a supportive environment for working and breastfeeding employees. And it does require that there is a policy of support for breastfeeding. So it's not just an LSA policy, for example, it really does need to be a policy specific to the purpose of supporting breastfeeding. And the minimum criteria or policy components that must be addressed in order to be recognized as a mother-friendly work site are that the employer must provide work schedule flexibility to allow a nursing mother to express breast milk each time she has the need to express breast milk throughout the workday. The law doesn't spell all of that out, but we do have administrative rules that are adopted at our agency and through our Board of Health to outline and flesh out the minimum expectations for the criteria laid out in legislation. So we do include the flexible scheduling criteria where not only is time provided, but that but flexible scheduling must also be provided to allow employees to make up missed time that over and above their usual break times for the purpose of milk expression. The law also requires for employers to provide a space for the purpose of milk expression, and that space must be a space other than a bathroom. And in our administrative rules, we've adopted the same criteria that are used by the U.S. Department of Labor for the reasonable break time for nursing mothers provision of the Fair Labor Standards Act. So the space has to be a space appropriate for the purpose of milk expression, a space other than a bathroom, and a space that's free from view and intrusion of the public and of coworkers. The employer must also, in their policy, assure that a clean, safe water source and a sink will be provided. This does not have to be in the lactation space, and the lactation space doesn't have to be a dedicated space. It can be any space that meets those specifications that I just described. And for settings where it might not be a brick and mortar facility, might be a state park or some kind of setting where there's not plumbing or running water, that's fine, so long as there is a clean, safe water source and some kind of basin that can be used for washing hands and washing equipment, breast pump equipment. And then also the policy must address access to hygienic storage alternatives for expressed breast milk. So this doesn't mean that the employer has to provide a dedicated refrigerator or even a specific type of storage, just that the conditions that allow moms to safely store their breast milk during the workday, whether that's in her own cooler, a shared break room refrigerator, a dedicated refrigerator, that the conditions are made available so that she can safely store her milk without excessive heat or any kind of toxins or unsafe conditions. So that has to be addressed in policy. Oh, I'm sorry. I wanted to say a couple of more things about the Mother Friendly Worksite program. So the program was established in 1995, and between 1995 and 2010, we recruited about a little over 230 employers to submit applications and to designate work sites. And I'll talk a little bit more about strategies, but this started off as really a bare bones, unfunded mandate, very little resources dedicated to the project, and we did have still quite a bit of interest, and were able to administer a small scale program to recognize employers. In 2010, I applied for and received a competitive grant for the Centers for Disease Control and Prevention through Communities Putting Prevention to Work. And through that, I was able to bring the program to full scale and really work on sustainability and integration of the program into existing structures within the state, promoting awareness about the program and building some outreach partnerships. And then after the period of that grant, was able to secure funding for additional staffing support through the Mother-Friendly Worksite Technical Assistance and Support Program. So it really now is a full-scale program. And since 2010, the program has increased by over 1,000%. To current number of work sites designated is 2,636. So up from 233 in 2010.
So this is Amanda Reet, and as Julie just mentioned, the expansion of the program into an additional arm of it as the Texas Mother-Friendly Worksite Technical Assistance and Support Program. This is a program of the Texas Department of State Health and administered by UT Health School of Public Health in Austin. And this is to assist employers through the Mother-Friendly Worksite Program designation process. So we do several aspects of assistance with employers. We also work to raise awareness about the program and build some capacity for sustainability through partnerships and collaboration. And we also conduct research, which is what I'll be going over today. We have a couple of different research projects, but the one that we'll be discussing today and the one that probably many of y'all are familiar with is the cross-collaboration research efforts. So we called them the state or the project, the State Initiatives Research Project. So I'm going to be discussing state initiatives or programs. So we ran into some verbiage issues. So for here on out, I'll be referring to initiatives and programs interchangeably. Some states refer to this type of work as an initiative and some call it a program. So the State Initiative Research Project began in efforts to really address the fact that many workplaces have sites in multiple U.S. states. And we perceived that there was a barrier to many workplaces who have multiple work sites in multiple states. And going up the long chain of command for just one work site could be a hassle in one state. So one way to possibly reduce this barrier might be to collaborate with other programs or initiatives like the Texas Mother-Friendly Worksite Program in other U.S. states to create a sort of direct line of communication, so that if a company would like to become recognized in Texas, but their headquarters or another office is in another state, we could direct them to that state's initiative or program. So this can make it easier for workplaces to become recognized, and it could also increase the number of workplaces in the U.S. who are promoting lactation support in the workplace. So in efforts to dig a little deeper into this possible solution of collaboration, we wanted to first find out what other states had programs that were working to promote workplace lactation support via a recognition program or initiative, and also to reach out to ask if they were interested in such a collaboration. So I'm not sure how many of you out there were interviewed for this research, but either myself or a couple of other folks in this room have probably interviewed some of you, and we're glad that you're here. So just briefly to go over the methods, we use semi-structured interviews to sort of get at these research questions. These interviews were conducted by 4 of our trained researchers from UT Health, and they lasted anywhere from 20 minutes to a couple of hours, depending on how much the representative of that state had to say. So for those states that had an initiative, we asked them an overview of the initiative, or for a description of the overview. We asked them about the background of that initiative, the components of the initiative, what was required, if anything, of the work sites. We also wanted to know how the initiative was developed and some questions around sustainability So these are just a few of the questions that we asked. We had quite a list of questions in addition to these. So our research findings, we found that 25 states didn't have a worksite, a statewide worksite lactation support recognition initiatives. 4 did have one in the past, and 25 have one currently. So the current ones you can see here are in sort of teal color. And of the 25 states with an initiative, 8 were overseen by a health department, and 10 were overseen by a state breastfeeding coalition. And then there were 7 states who had an initiative that was overseen by sort of a combination of either the health department and coalition, or university efforts along with the coalition. And the number of work sites that were recognized by each state's initiative ranged, as I'll show you in the next slide. Some of the initiatives were pretty new, so some initiatives had recognized just a handful, and as Julie already stated, Texas had a little lead time, yes, to recognize 2,636. So for our duration, as Julie mentioned, Texas did have the oldest one that we found. So in 1995, it was created, and 11 states created their initiatives between 2000 and 2009. Oh, and it looks like we're having some technical difficulties. Sorry, folks, we're... Did it cut out? Sorry about that all.
Can we just call in?
Yeah.
Call in. I don't know how to use your phone.
I'm sorry about that, folks. Our sound just went out for no reason. Apologies. Hopefully that won't happen again. So I don't think I got too far into this slide before it cut off. So yeah, I think I was at 11 states. So 11 states created their initiative between 2000 and 2009. And 11 of the states had a relatively new initiative that was created in just the past decade or less. There were 2 states that weren't quite sure when the initiative started. They weren't necessarily there at the time that it started, so they were unsure. Here we go. So we found that 20 initiatives require employees to meet specific criteria to be recognized. And many of those initiatives require very similar components that Julie discussed for the Texas Mother-Friendly Worksite program. And the most common was a private space and flex time. So all of the 20 that required criteria required these 2 components. Many initiatives also required that there be some kind of communication to breastfeeding employees about the initiative or about their policies. Many also required a sync. Some required storage and additional resources like lactation support through the community or educational resources.
And one point about this slide, so Texas doesn't have a check here about under communication, but that actually is a requirement, so we need to correct that. But I didn't mention that before, but in our administrative rules, we require that not only does the employer have a policy, but that it is a written and communicated policy, that they have some method of communicating the availability of their policy to their employees.
Thanks. And I did want to point out that, so a written policy was
required by 10 of the states, or a verbal agreement was also required of some of the states. So the states that have a plus minus sign didn't necessarily require a written policy, but did require some kind of verbal agreement between the employee and employer that they would provide workplace accommodations. And we found that 11 initiatives offered an enhanced level of recognition. It's not shown here, but the most common criteria for that enhanced level of recognition would be a written policy if it was not already required at the most basic level, a private space with what I call extras, so a comfortable chair or a small table or an electrical outlet or wall clock, and storage if it was not already required at the basic level, and extra time like ability to work from home or job sharing or 6 weeks paid and unpaid leave. And then also communications were often a sort of extra with educational packets or educational materials for all employees about breastfeeding. And I do want to point out that 2 states, Georgia and South Dakota, have a pledge initiative, and 3 states, Massachusetts, Nebraska, and Indiana, didn't have necessarily mandatory criteria that they required of all work sites, but they do have a program. So I wanted to briefly talk about the sustainability themes that we assessed in this research using the program sustainability assessment tool developed by Douglas et al. We assessed the 9 programmatic sustainability domains like funding, organizational capacity, internal support, partnerships, and communications. And I won't go too deep into all of these, but some of the barriers discussed around these domains sort of related to the ever-changing resource and funding climate that many found themselves in with this work. And many initiatives were really powered through volunteer woman hours, so having enough time was often a struggle. And then on the flip side of that, in so many of the interviews, we heard participants say that their internal and external partnerships really powered their initiatives. So those helping outside organizations or folks who had time really helped to power their initiative and support their program. So the support they received from outside organizations was critical to continuing the work of their program. So now I'm going to hand it back over to Julie, who is going to talk more about addressing some of these programmatic challenges related to these sustainability themes. And I just want to say a quick reminder that if you have questions about this research portion or about what Julie will be discussing, please feel free to type it in the chat box and we'll address them towards the end.
Thank you, Amanda. So I'm going to talk a little bit about from my own experience as a state-administered program, and so I might not have answers for programs that are administered in another way, and you might have more answers for some of these than I do, or different answers. But I'm going to share a little bit about what I know just based on my experience with this program, and I've worked with this program for over 12 years. And actually, even before I worked with the program, when I was working on my master's degree, I took a health policy class and analyzed this program did a policy analysis. And then I also was an intern with Texas Department of Health before it became Department of State Health Services, and worked some with this program then too. So I've really seen it throughout a good chunk of its life course. So some of the themes that Amanda talked about, funding, I can tell you I've done this program with no funding when we started. And when I say no funding, we did have a little bit of expenditures kind of, within existing resources type costs. So there was, I guess, in my job description, there was a 5% allocation for breastfeeding activities, including mother-friendly worksite. So, if I had an 80-hour work week, then I could really put some time into this program. We were able to get funding from our WIC program for printed materials, very basic printed materials. So we had we had an internal designer in our art shop design a certificate and a decal, and those were provided to employers after becoming designated. And so there was a massive printing of those, and that was paid for through WIC. We did collaborate with our state comptroller to get a list of businesses in the state, and there was a massive mail out after the law passed to promote the designation and to encourage people to apply. And so that had, probably postage expenses and printing. And then I did, at some time well into the program, was able to get a display board made, just a very basic display for about $300, made in-house, designed in-house and printed. So that was really my working budget for the program. Also, in collaboration with WIC, we developed materials for working mothers about working and breastfeeding. And so that was a parallel effort that referred to the Mother-Friendly Worksite program, but it really provided information for nursing moms on how to combine working and breastfeeding. And so that partnership with WIC, really throughout all of the breastfeeding work that we've done as an agency, Maternal Child Health and State WIC working together, has been a power team to get things done and to share resources and make create synergy. So that was kind of at a most basic level. And I'll talk more about funding through these other steps too, because it's really hard to separate out funding from these other steps, because you need champions, you need partnerships, and even some of the outreach strategies are opportunities to identify sources of funding. Right now, and in the past, there have been some opportunities that were not currently available at the time that our program was established, particularly with all of CDC's great work around breastfeeding. And so not only has there been some funding opportunities available through the CDC and through folks that they fund, through organizations that they fund around breastfeeding, including ASTO and other organizations, but also, and NACHO, I believe, but also there's been more foundation support. So W.K. Kellogg Foundation has funded multiple breastfeeding activities, as well as Robert Woods Johnson Foundation. So there are some usually smaller funding opportunities available, and it really doesn't take a lot if you do the rest of it well. Of course, it is nice to have funding, and during the period that I had the grant, I certainly maximized, squeezed every bit of value out of those funds that I could, because I didn't know when I would have funding again. And so I really worked on building structures that would support the program even in the absence of funding. And because we like to share, and also because those were federally funded, those resources are available to any state. You can contact me, and we can talk about your use of those, and you can rebrand them for your state, or if some people have asked to adapt them, and we just ask to be involved in that process and talk through it. But you don't need to reinvent the wheel. There's so many great resources. And now we have funds allocated through Maternal Child Health Block Grant, and with the Title V 2.0 strategies and national performance measures specific to breastfeeding. I know many more states are focusing on breastfeeding through their block grant efforts. So it's wonderful to have some funds available to have a full-scale program. But I can say, even without the support that I have through our current efforts with the Mother-Friendly Worksite Task program, we were still able to increase the number of mother-friendly work sites before that program up to about 1,800 from 233 with just me doing that. So that moves into time because time is important. This is a time-intensive project. Those of you who are already implementing this type of program can attest to that. If you are screening applications for criteria, then not only is there time invested in that, but also in providing communications with the employers to help them have their policies and their programs meet the minimum criteria that you've set forth. There's a lot of time spent communicating, not just with employers and potential partners, but also internally. At least I found that to be true in my agency. And so I would recommend for states that are establishing a program like this to at least allocate half an FTE, if not more. And of course, the more staff you have, if you build a program that is scalable, so that as your scale grows, as your reach grows, that you're able to scale up. That's what I would advise. But you can also get time through partnerships. They take time to build and to maintain, but they also can help develop infrastructure for you where you're not having to do all the work alone. People are happy to promote these efforts across your state, across our state, as part of their own, to achieve their own objectives through their own funding streams, and not always just volunteers, although volunteers are wonderful as well. So moving into champions, so I talked about how much time is spent just even internally communicating, and when I was implementing the grant that I had to bring our program to full scale, I also became a marketing expert, not just for mother-friendly, shouting it from the rooftops out into our state, but also for internal marketing and building champions, identifying champions, and empowering them with information so that they could serve as champions. And so finding folks that are interested and that have the ability to influence decisions is really important. They might not know much, if anything, about breastfeeding in general, and they particularly may not know about how important this topic is for the success of breastfeeding mothers. And so a lot of what we've done is to develop data systems in our state around breastfeeding. And so I have data from our state, from our moms in our state, that really help to sell this as a very important public health issue. So that's not on this slide, but I would put it first. Before you talk about funding, look at your data. And if you don't have data, figure out how you can get it. And then, so in my agency, I was very lucky to have a director that in the past that was very supportive, and currently too, but that was very interested in breastfeeding as an infant health necessity, and helped me to communicate the importance of this up to our higher leadership, and we're able to find several champions at high positions. And then also externally, having our Breastfeeding Coalition concerned with this topic, physicians in our community, our medical associations, all of and local public health partners have all championed this initiative. So outreach, there are a lot of different ways that you can reach employers, and we do have an outreach partner toolkit at the link that you see on the screen that has tested ideas. But the way I like to approach outreach with few resources, with no funding and not a lot of time, is really around through partnerships. So working with the groups that you are already in contact with in your work, and starting there, starting in your own house, starting with your own employment setting. So your agency, your coalitions, your groups of stakeholders, are they implementing mother-friendly initiatives? So that's tends to be more effective kind of direct outreach than just going blind calling employers or whatever. But if you have relationships, then you're able to reach those different employers, and you can do direct outreach with them. So, and they might know of other people. So that's a really effective way. Also, of course, there's exhibiting at conferences, including your Society for Human Resource Management. That's been kind of the biggest bang for the buck for the most part, both the regional meetings and then also local SHRM affiliates. And then talking to facilities managers. There's a bunch of different types of groups that are for facilities management, and they're such an important partner in this work that I haven't been to too many of those conferences, but I've certainly presented at their meetings before, so that can be important. And social media, of course, if you have the capacity to use social media, it can be an effective way to reach lots of folks and engage them, and provide information to kind of plant the seeds about why this is important. The other two things that are listed here, the webinars and forums, I think are really important, because it's one thing for employers to develop a policy and submit it for approval, to be recognized, but it's a whole nother thing entirely for them to implement that policy. And more, because we do have the capacity now to offer these kinds of more customized technical assistance opportunities, we hear from employers that already had a policy who haven't implemented them, and they're really looking for strategies, and this is a great way to give strategies. So through technical assistance webinars, through cohorts of employers, a program where you're recruiting a whole cohort of different types of employers. Right now we're focusing on cities and counties, and that's related to partnerships, which I'll get to in a minute. Those are really helpful in not only just getting numbers of employers, but numbers of employers who are really walking the walk and sustaining their efforts. So the other thing here, forums, that's an idea that we stole shamelessly with permission from LA County, and we've hosted forums over several years, and now we're doing them pretty regularly, where we're partnering with local communities and asking them to outreach to employers in their communities, especially ones that they're interested in targeting for their populations that they serve. So usually public health partners are helping us organize this, like WIC. And then having me present about best practices in worksite lactation and kind of the public health case, having a business who has implemented worksite lactation programs talk about what that meant for them, kind of the nuts and bolts, but also why it was important to them from a business case. And then having Mother-Friendly Worksite Task Program talk about the supports available to employers. And then also having EEOC and U.S. Department of Labor representation. And if we had a point of contact in our state for state laws, we would have that too. They did in LA to talk about the legal case for employers. And that way, that's a good draw for employers to come and learn that information. So those are all some of the outreach strategies, and there's others in this booklet, and you might have more. And the best for last, partnerships. I can't stress enough how important partnerships are for having an effective program, having reach, and having sustainability, and identifying funding, champions, time, and even outreach. They're the key to it all. So in Texas, some of our early partnerships were sort of what I talked about when I talked about direct outreach, is kind of starting where our immediate sphere is, and working with programs within our department. So working very closely with WIC, working with our obesity prevention program to integrate mother-friendly metrics into their strategic plan for obesity prevention for the state. Working with our state agency Worksite Wellness program to integrate breastfeeding as a criteria for worksite wellness programs. Working with, now this week, I'm working with our cardiovascular disease prevention and stroke program to incorporate breastfeeding support, including mother-friendly, into their strategic plan. And then mother-friendly is also a metric for our Healthy Texas Cities stroke and heart health program that works with local communities to develop healthier communities, and so they can work on mother-friendly worksite and also Texas 10-step and baby-friendly hospital designation. So that's just within my own agency, some of the really strong partnerships that we've built. But then also through working with employers, we use this approach of starting with our sphere of influence and working with local public health departments across our state, and moving on to cities and counties. And that's been it's what I had hoped happened, but it actually did happen. It actually worked. And it's been such an incredible benefit. In addition to having those work sites being mother-friendly, many of those areas have developed their own champions through that process of making a mother-friendly work site. And they've incorporated mother-friendly as a metric in their community health improvement plans, in their activities for grants, and other efforts that they've done. They've sought funding specifically to do outreach with employers in their communities around worksite lactation support. So the way that works in our state is we have this program at the state level that can really be the subject matter experts and provide that very specific individualized technical assistance, while our partners all across the state can be singing the song of why this is important. There are outreach partners, they're promoting the program, and then they kind of hook in the employers, and then they refer them to us, and we're able to support those employers in meeting their needs to get their policy in place. So and then those partners are also getting a win out of that they can use to meet their objectives with their funders, with their local community health needs, etc. So that's my favorite bullet on this slide. So now that's my spiel, and if you do have questions, please type them in to the chat box. And there's a couple of slides here talking about what possibilities for next steps are. So as Amanda said when we started this call, that part of why the research was done was to identify what kinds of opportunities there might be to collaborate with other states, so that employers that have work sites in more than one state can, we can help them get as many of their work sites designated, and also help each other as states to expand the reach of our programs. So, so this call was kind of the first step of that, and well, the research was the first step in that, and then this call is to share those findings with you, but then also present what our ideas are, and we want feedback and other ideas as well. So some of the thoughts that we've had, just at a pretty basic level for collaboration, would be for programs where there is a recognition program that has criteria to share information on your websites with, or how, by whatever means you have, for that there are other programs in other states. And in order to help that process, for those states that want to participate in this, to provide brief standardized descriptions of your programs and your program's criteria, so that we can, so the employer, it's up to the employer to see where there might be differences from state to state, and they can adjust their efforts to try to get designated in as many states as they have work sites where programs exist. And so that would be us sharing information with each other and about our criteria and kind of standard descriptions, but then also having some kind of method that might vary from state to state for sharing that information with employers. And it doesn't have to be that you're working hard at it or anything. It's really just giving them the information that you have, and then leaving it up to the employer to take it from there. We also know how, many federal partners have created these great opportunities for us to communicate with each other, and so there may or may not be a need for any more of those opportunities, but it does seem like having some kind of continuing communication with states that have programs where we can share information and bounce ideas off of each other about how to implement our programs might be useful. And even if that's just a site where we share tools or whatever. And one idea was using a platform called Basecamp, which is just it's an online project management site, but you can basically you can use it as like a chat room, and you can attach files there too. So that's one idea. So we want to assess interest in that, and with consideration to the fact that there are other platforms for sharing, and we don't want to duplicate efforts. But this is a little different than some of those platforms. So, so we do want to have another call to talk with states that would be, so this might be a more narrow audience, but we want to talk with states that have programs, have recognition programs, or who are working to develop programs to have a conversation. And we've selected this date, September 28th at 12:30 p.m. Central Standard Time. So that'll be a different time wherever you are if you're not here in the Central Standard Time Zone. But and we want to talk about ideas and best practices for worksite lactation support. So some, just some brainstorming and general information sharing, and then talk about ways for initiatives to improve and pathways for collaboration. And I think our intention after this call is to send some communications, perhaps some surveys, and so that we could provide some structure around the call, so it's not just totally free form, but we do want it to be interactive. So that's our next steps, and we hope that some of y'all will be interested in that. And now we want to open it up for questions. And so if you want to chat those in.
We have a couple. Also, I did want to piggyback on that. So just after this webinar ends, you'll receive a survey. So it'll just ask about your interest in continuing this process with us and being engaged in this process. And again, as Julie said, whether you have a program currently or whether you're interested in developing something like this, we hope that you'll join us in that process. So can I ask one question first before a quick one, because I love data, and you mentioned figuring out how to get data. I wondered if you have any direction or where to direct people to have tools to collect that data. So do we have any survey tools or do you know of any?
Yeah, so in our state, in Texas, we have a couple of different surveillance sources for breastfeeding. We have several, but for Worksite Lactation, the ones that I use are, in Texas, we have a WIC infant feeding practices survey that we administer across all of our WIC local agencies across the state every 2 years. And so that's a paper survey that moms that participate in WIC fill out about their breastfeeding experiences, both personal and then also their environmental and system experiences. And then, and so that's where we can have real state-specific data about that breastfeeding is the leading barrier for for working mothers who never initiate breastfeeding. And it's also the leading reason that working mothers in the WIC program wean early. And we also know that among those moms that did wean, for working moms, that the vast majority of them did not breastfeed for as long as they wanted to. We can also assess information about their awareness about whether employers and that their employer is supportive of breastfeeding, both in general and then also in providing the specific criteria that we require for mother friendly. So that's a really rich data source that we have. We also have added questions, and at the time we were the only state that had done this, but onto the behavioral risk factor surveillance system, and we've done a couple of different breastfeeding modules, but one about the greater community's kind of attitudes towards working and breastfeeding. So that's another source. And then we also have done a lot of qualitative research, including focus groups and key informant interviews. And some of those data are available on our Texas Mother Friendly Worksite website, kind of in a hidden portal on the page for public health partners. There's some resources there. Yeah.
Can we send that?
Oh yeah, we can send the link. It's not really hidden. It's just kind of sort of hidden.
Okay. It looks like someone else had a similar question asking about if we could share that kind of data that was collected to support the initiative. So maybe we can send out that link.
Yeah.
Perfect.
And then, also this program, the Texas Mother Friendly Worksite program, is recognized by the CDC's funded Center for Training and Research Translation at UNC Chapel Hill, and they have bundled the whole program for other states, as a best practice. So you can go there and learn about some of the activities that I've talked about, and then also the data sources, and there's links to that. So that'd probably be the most concise thing to send, because it's got all of that information there, as well as recommendations for how to evaluate this type of program to be not only practice-based, but evidence-based. So.
And there was another question about the link that's on the webinar that's not available. So we'll also send that out when we send out the other data links.
And we'll send the slides as well.
Yes, thank you for saying that. So someone asked, what is the incentive for businesses to pursue this designation?
So the way that we've marketed it is that it's a great recruitment tool. It's a way for employers to promote to the workforce that they will help meet their needs, that they're mother friendly. And we also include information about how to make it dad friendly too when we're talking to employers, and there are plenty of ways to do that. We talk about the business case and the return on investment for employers in implementing a comprehensive program of support, and a policy is certainly part of that. And so you might as well go ahead and get designated as the mother-friendly worksite while you're working to experience a $3 return for every $1 invested in Worksite Lactation. There's also the legal case, which there's no law requiring mother-friendly worksite designation, but there are laws around this topic, and so employers are interested in having a policy and some kind of designation because it's a way for them to, make sure that they've addressed it and that they have something that they can publicly hold out to say we're in compliance with laws. Although that's not our role as a program, is to ensure compliance with laws. I want to be really clear about that. But that is, I've heard from employers, that's one of the reasons why they're interested. Really, the thing that we heard the most is that it's kind of the right thing to do. And you can look at the qualitative research that I referred to on our webpage, but one of the things that we've found is that there's once employers are aware of the disconnect that they are living in, where often employers think that it's not an issue, there's no proactive reason or no reason to be proactive about this issue because they're not hearing from their employees about this need. And so their assumption is that everything is fine, mothers are having their needs taken care of. And then what we hear from employees is that they're afraid to approach their employer and their needs are not being taken care of, and they wean early and they're really unhappy about it and they're really uncomfortable physically and emotionally before that. So there's a disconnect, and so promoting awareness about that has been important for employers to want to participate and do the right thing.
Another question is, there's been an increased attention on the needs of breastfeeding students, which mirrors the needs of breastfeeding employees in many ways. Did any of these programs you explored focus specifically on the needs of teachers and students? I don't think I came across anyone who specifically mentioned focusing on teachers and students. There were certainly people who had worked with the ISDs around them or around either locally or just across the state. So I didn't experience any focused attention to that, but Julie, do you have some words about that?
So there is, first of all, that's kind of a two-parter question. So first of all, there are very similar needs for students. In my experience, in trying to promote support for both populations, it's been important to employers to keep those topics separate. And so you might start with supporting your own employees, and then if it's a school, and then maybe talk about students, or if you have relationships that help you talk about supporting students, you might start there. But to try to bundle them they're really different types of even legal structures, so it can be complicated, and there's also all kinds of other opinions and attitudes and issues around it. So keeping them separate, I think, I've learned is important, and there are big needs in both areas, and a lot of states, including our state, like we have a recent state law that requires similar things as the Fair Labor Standards Act requires of public employers. It only applies to public employers, but it applies to all public employees. And so that includes teachers. And the coalition here that advocated for that law did so primarily to fill that gap of providing some kind of protection for teachers to have the right to express breast milk during the workday. Students, there is some guidance. It's not prescriptive. It doesn't require that schools provide lactation support for students, but there is a document from the U.S. Department of Education. I can't remember what it's called or even what the law is called, the federal law that requires for schools not to discriminate on the basis of sex, and it does address lactation and it recommends for schools to support students with lactation, but it doesn't require it. So we can send that too. It's a very important topic.
Someone also, so in my, when I hear students, because I am a PhD student, I think of college students as well, and I do know that some of the states had universities who promoted these initiatives. So there are some initiatives out there that are also working with those students in some capacity, at least by proxy of just their setting is the university. And actually, we just had a caller or someone who's called in from Colorado who said that they have worked with schools and universities of Northern Colorado, and they have a toolkit for universities and colleges. So we might be in touch and see if that's something that you're willing to share in the future.
Great. And it's Title IX is the federal code for students. And yes, thank you, Amanda. That's a good point. I was thinking about K through 12, but
I was too at first.
But a lot of universities do address their student population and their employee population at the same time when they're setting up worksite lactation programs at the university level. Not always, but that's an easier thing to approach.
So fewer restrictions because they're not
minors.
12. Right.
Yeah.
Okay. That makes sense. Another question is, can you talk a little bit about the designation process? Does someone go to the sites to evaluate them?
So in Texas, and this varies, and you could maybe speak to this, but in Texas, it's a desk review, and it's really just a review. What we're evaluating is the policy, and that's it. We do ask them in the application, so the policy has to meet the criteria, and there's also an application, and in the application they have to provide some narrative about how they're providing certain supports and what that looks like, and if we have concerns about whether that meets the minimum criteria, if they're implementing it in a way that's not consistent with the minimum criteria for designation, then we will counsel them and ask them about them and ask them to change those practices, but there is no site visit. So yeah, that's not a requirement of designation. If they are getting designated at the silver or gold level, which we do have in our state, then they do have to send in supporting documentation to demonstrate how they're providing those additional supports.
And some of the states that we spoke with do require a photo. Some states are able to attend or to set up a meeting at the workplace where they can see it. So I think it just depends on, and Texas is also a very large state. So getting out to El Paso from Austin is
12th biggest economy in the country. I mean, in the world.
So I think some states have the capacity to be a physical presence, and some states did not. So it really depended. Another question was, any thoughts on recognition programs for businesses who wouldn't meet the designation per se, but want to support patrons of their business? Okay, so we have, many states have like a breastfeeding welcome here type initiative. We have that in our state too. We have since 1995 when the Right to Breastfeed law was passed, breastfeeding friendly business designation or breastfeeding welcome here designation. Well, it's not a designation in our state. Some states have a designation. We just have certificates and decals that are available.
and businesses who choose to put those up can, and we encourage them, and we use outreach partners to promote those across the state and take them, to your doctor and your favorite restaurant and wherever else, and ask them to hang those in the window. Some other states do have a designation process for that. I think that I don't know that would be feasible in our state just because of capacity, the amount of time required for that. But other states are not as big as Texas and might have more resources. So there's lots of good examples of that around the country.
Another question is, when were the interviews done? What year? So the interviews for the research were done throughout the 15-16, essentially the university school year, and kind of bled over a little bit into the summer. So with that being said, there are perhaps some programs that we just were not able to capture, or maybe some were just starting. And I should have said that as a caveat whenever I discussed the results, that we reached out to folks who were either with the Breastfeeding Coalition in each state, and actually it ended up being coalition folks and also health department folks. So we tried to be as comprehensive as possible, but there still might be some initiatives out there that we were not able to capture just because of the time that we did it, and the folks that we were able to speak to. But the interviews took place last year, essentially. I think that's all the questions that we have. We are a little early, but please feel free to email us questions if you do have any. And I can put there we go. We do have, I want to acknowledge folks. This is really important, actually. This whole project was quite the effort. So we had TASP folks. Courtney Burr-Williams is the PI for the TASP in Alma Carver, which you've met already. Kelsey Heron, who has her headphones on and is listening in, and has orchestrated this webinar along with Riley Stoltenberg. We had so many graduate assistants and helping hands on this project that it just would not have happened without them. And of course, our DSHS collaborator, Julie Stagg, and our funder. So on this slide, you can email any questions about any aspect of this webinar to the Mother Friendly Worksite email. So any follow-up questions that we did not get to, please reach out. And if you have questions regarding any of the resources that were mentioned by myself or Julie, please don't hesitate to reach out. And then if you will complete the survey afterwards so that we sort of know how helpful this webinar was, and we know who would like to be interested in the next webinar, we would love to have you all join in.
And if you're on the webinar and other folks from your state that should be are not on the webinar, please share this information with them. We would love to engage as many states that have similar programs and are interested as possible.
Yeah, thank you for saying that. It's important. Thank you all so much for attending, and hopefully we'll see you next time.